Dr. Chris addressed the nation's worries about so-called Aussie flu on This Morning during the health headlines with Holly Willoughby and Phil Schofield. He said the flu outbreak in Australia has been the worst for 50 years. The flu they have in the southern hemisphere tends to be what we get afterwards. This is why in the UK we make our flu vaccines for this winter in March. In Australia they're having a very severe strain, and the strain of the virus is changing. The flu outbreak this winter will be a huge drain on the NHS if we're not ready for it. We have a flu vaccine for children over here, the nasal spray, which they don't have in Australia, which may be why it's been so bad over there. What is the Aussie flu? The flu virus is reportedly similar to one that circulated in the UK in the winter of 201,415. Worryingly, it caused a significant number of deaths, and elderly could be particularly susceptible to the Aussie flu. Symptoms of flu and symptoms of Aussie flu are generally the same, however, at times H3N1 cases have been reported as more severe. Professor Robert Dingwall has warned a strain of the flu dubbed the Aussie flu could well be the most serious outbreak of the virus since the 1968 pandemic that killed more than 1 million people worldwide. Australian hospitals report record numbers of citizens needed treatment for the strain of flu during the winter, which is coming to an end. The strain has been called the H3N2, and it's a vicious winter bug. Can I treat the Aussie flu at home? The flu, or influenza as it's known in medical books, is a virus, which means people suffering with it should wait for the symptoms to pass. It's important for people to rest, keep warm and drink plenty of fluids to avoid dehydration. You should see your GP if your symptoms don't improve after 7 days. You're worried about your child's symptoms, you're 65 or over, you're pregnant, you have a long-term medical condition, for example, diabetes or a heart, lung, kidney and neurological disease, you have a weakened immune system, for example, because of chemotherapy. A high-Getty Aussie flu, a killer strain of the flu, could be en route to Britain Monday, March 20, 2017, also known as the winter vomiting bug. When people are ill with vomiting and diarrhea, it's important to drink plenty of fluids to prevent dehydration. Young children and the elderly are especially at risk. People at most risk of serious illness or death if they get flu are offered the vaccine. Can you protect yourself against the Aussie flu? The composition of Britain's flu jab this year does contain protection against the Hong 48,012,014 H3N2-like virus, the World Health Organization states on its website. On the 2nd of March, who published it is recommended that trivalent vaccines for use in the 20,172,018 Northern Hemisphere influenza season contain the following: and a Michigan 452,015 H1N1 PDM09-like virus, an Hong Kong 48,012,014 H3N2-like virus, and a B Brisbane 602,008-like virus. People at most risk of serious illness or death if they get flu are offered the vaccine on the NHS. Ideally, you should have this before the end of December. Getty Aussie flu. The H3N1 strain has caused issues in Australia. Speaking about the Aussie flu, Professor Dingwall told the Daily Express, based on the Australian experience, public health officials need to meet and urgently review emergency planning procedures. Public Health England should be working with local authorities and local health services to ensure more hospital beds are freed up. We need to be prepared, alert and flexible. There is no point in trying to close the borders. It's almost inevitable this will come to us. This is potentially the worst winter since the Hong Kong flu outbreak of 1968. Lots of people have been very badly affected in Australia, and whilst their mortality rates are not out yet, we suspect this is a more severe strain than most other years.